Hi, this is Joe DiMatteo Jr., pharmacist, certified clinical nutritionist. Thank you for joining me today. I'm going to talk about B12, all right? Very critical nutrient. It was something that for me, I thought basically I knew all about and ended up wanting to do a video on it. It's something that we had not done before. So in researching it, really found out a ton for it. Again, I always knew the basics, but going through a deep dive of B12 itself and also our particular supplement and why it is the form that it's in really even shed a lot of light for me on this topic. So hopefully you find it as beneficial to watch or listen to as I found to research and to do here. So B12 is one of the 8 B vitamins. All right, B vitamins are water soluble. Okay, basically just means doesn't get stored in fat. It's not absorbed any better in fat. It's happy in its water state. But it is a nutrient, one of the few water soluble nutrients that you can actually get a level on, which is so important, and we'll get to that later, and so helpful in terms of determining whether you need to supplement with it or not. So there are 3 main, we'll call them main functions of B12 that are discussed both in traditional and alternative medicine, but these kind of are the 3, traditional core medicine benefits of B12. We'll go into more detail, but I'm just going to give you the 3 quick hits here. Production of red blood cells, number 1. Red blood cells are the type of cells, blood cells that carry oxygen to different parts of the body. Number 2, myelin sheath production. Myelin is the material that makes up the myelin sheath, which is essentially, if you think of an electrical wire, it's not the part in the middle that's the metal that's conducting, it's the rubber or the insulation material that's around it. So that's myelin sheath. Your nerves have that. So that's the electrical version, but your nerves function in the same way, basically. So that's the protective, insulating part of your nerve, the myelin sheath. So that's B12 is critical in the formation of that. That is your link to dementia, your link to peripheral neuropathy, and even mood issues. All right. Number 3, B12 is involved in DNA synthesis. Okay. Your body is constantly regenerating cells via DNA synthesis. B12 is critical to that process. You notice it particularly in cells that have high rates of turnover, like red blood cells and like the lining of your GI tract. Again, cells that regenerate very quickly. You're going to notice any deficiency or issues in DNA synthesis. Okay, and that's not even getting into issues with cancer, etc., in terms of your DNA not being synthesized properly, which B12 is critical in. So those are the 3 core. They're discussed in alternative medicine, but those are the main traditional medicine uses and functions of B12. A little more lesser known, more in the alternative kind of family, is it lowers homocysteine levels. Lowering homocysteine decreases your risk of cardiovascular disease, including heart attack and stroke. Okay, it's also involved in serotonin and dopamine neurotransmitter production. B12 is okay, so that's your link to mood, to sleep, different psychiatric disorders. B12 is critical to methylation. So I'm sure you've heard of that. That's definitely a big buzz term now in more alternative medicine. Okay, along with B6, folate, nutrient like trimethylglycine, B12 is critical in methylation. Okay, methylation in its most technical form is a biochemical process. Methyl groups are added to molecules. But what does that mean? Basically, it means it's part of a body process that is involved in DNA synthesis. It's involved in detoxification, neurotransmitter production, hormone production, among other things. But those are the big, functions of methylation, of which B12 is critical. So to dig a little deeper here, we'll go back to the red blood cell production. Okay, a deficiency in B12 leads to megaloblastic or pernicious anemia. This is the reason why most docs are going to check your B12. Okay, which are actually, that type of anemia is actually a misshapen red blood cell. Okay. Again, it's the most common reason why your doc's going to recommend you get a B12 level. Okay. It would affect your body's ability for the blood to carry oxygen when it's misshapen like that. Okay, so you're not getting oxygen to parts of the body. Can lead to peripheral neuropathy. Can lead to even downline fatigue. physical, mental fatigue, irritability, brain fog, headaches, rapid heartbeat, even GI issues. More extreme cases, you can get jaundice and unsteady gait, really coming from that lack of dopamine production. So you're typically linking it to fatigue and brain fog, but it can be a lot worse, okay? So that's, again, the most fundamental, use of B12. So maybe you're not full-blown deficient or anemic, but you're on the lower end of that range. Or maybe your body, just you personally need a little bit more to maintain those proper red blood cells. Could possibly be a reason why you're experiencing some fatigue or some brain fog, okay? It's not a one-size-fits-all. Remember, these reference ranges, they're taken from a sample of the population. This is not this black or white deficient or not. You're looking at these numbers are, again, taken from the general population in terms of figuring out what you should be, okay? Let alone it's not personalized to you, okay? Also, there's different definitions of what is low borderline, okay? For example, traditional medicine, there are some differences there. Usually below 200, you're considered deficient. 200 to 300 is borderline, okay? But that's in the U.S. So in Japan, the cutoff is actually 500. So think about that. In the U.S., it's 200. In Japan, who's typically much further ahead of us in we'll call it alternative medicine or nutrient and herbal type medicine, that believes that the cutoff is 500. So again, maybe your doc says your level's good, but you're experiencing fatigue or brain fog, or maybe we'll get there, but maybe it's an elderly person and you're looking at some different memory issues, dementia, peripheral neuropathy, and your level's 200 or 205. Well, they say you're okay, or maybe you're borderline. Well, in Japan, they would say your level's half of what you should be. So we believe more in the Japan level of 400 to 500, okay? So that's, critical as well when you're looking at the entirety of B12 supplementation and when you get your level done. So number 2, B12 is critical, like we talked about, to the production of myelin, okay? So if you're not creating that insulation for the nerve, you lead to demyelination, which, think about a electrical cord where that outside gets cut or gets damaged. What does that do to the conduction, okay? That's where your increased risk for dementia comes in, okay? The many studies have shown that link. A severe B12 deficiency, pretty much right away, but particularly in the elderly, you will notice short-term memory loss. Now, if it's related directly to severe B12 deficiency, it can be reversed pretty quickly, but you will notice it in pretty short order if you've got a severe deficiency, again, particularly if you're elderly, via the short-term memory loss. So again, I'm going to keep harping on it. The level, particularly for somebody dealing with fatigue or really an elderly person, not borderline if you're 200 or low, only when you're below 200. You've got to be at that 4 or that 500 level, okay? So it's a pretty vicious cycle because as you age, your B12 level goes down. Really, your body's making less intrinsic factor. Intrinsic factor is a protein that absorbs B12 in our gut. Okay, so when you get older, that protein is made, and there's less and less of it in your body, so you need more B12, but your level's going down mainly because of intrinsic factor naturally dropping. Also, elderly people tend to be on medications that can cause it, so it's one of those vicious cycle, chicken egg kind of situations. You need more B12 because you're older, because you're at risk for dementia, but your body is actually having a harder time absorbing it because of those issues. So it's pretty critical, again, to get checked and to deal with the level properly. A 2008 study, for example, showed that lower B12 levels were literally associated with the physical size of the brain in elderly. Brain shrinkage was associated with B12 levels, okay, direct correlation. 2011 study showed that elderly patients who took a B12 folate B6 supplement had less brain shrinkage. So that's not just checking the actual levels. This one was just looking at if you're supplementing with it and taking in a good quality form, showed difference right off the bat. Then a study published in Neurology in Chicago in 2011 showed an association with low B12, serum B12, smaller brains, but also, okay, lower scores on thinking, reasoning, and memory tests. So a direct link on cognition. This was also in the elderly. So, pretty clear there. It could have done a dozen more, at least, of studies linking that B12 level to dementia risk, particularly in the elderly. So also, if your B12 level is low, you have an increased risk for different linking to nerves, neurodegenerative diseases. Okay, so it's critical. It's not going to cure your neurodegenerative disease, but it's critical to keep the level up. In terms of prevention, maybe you've got a history of it in your family, or just as a baseline to help deal with some of the symptoms. Those diseases include Alzheimer's, Parkinson's, multiple sclerosis, etc. All show direct correlation, low B12 status. Okay. What's also been shown is the B12 status with age of onset. So they can directly see that. I'm going to go into the details of it, but basically, you're more likely to have an early onset, or those who had early onset had lower B12 levels than those with onset later in life. So again, I'm not claiming that it's a cure, but it can help to prevent, particularly if your level obviously is very low, or you've got a history of these types of diseases in your family. So back to number 3, DNA synthesis. B12 is critical to the formation and also the stabilization of DNA, okay, in those cells that are replicating. All right, I'm not going to go tell you that B12 prevents cancer, but it's pretty clear that when the replication issues and the stabilization of properties of B12 can certainly potentially have an effect. All right. In fact, in a research paper done in Greece, talked about the role of B12 in preventing birth defects, okay, due to that, the properties of B12 being involved in DNA synthesis. So when B12 was supplemented and given and levels were good in the mother, it did help to prevent birth defects, okay, and it also did protect against the risk of neurodegenerative diseases later in life. So that they followed patients in Greece. So really shows you again the link between those issues. Further, B12 involved in depression and mood regulation. This for me was one of those things when I began researching this that I was not aware of to this depth. Okay, B12 is involved in serotonin and dopamine production. Okay, so this is a secondary cause for potentially B12 helping with energy boost, not just the anemia issues, the fatigue we talked about, but also particularly dopamine. If your dopamine level's low, it can affect your energy level. Okay, and that's kind of your reward hormone and kind of a ability to get excited about things, etc. If you're not producing that properly, it can certainly leave you feeling a little down, a little fatigued. Okay. Furthermore, serotonin production is linked to melatonin directly. Serotonin converts to melatonin. So if you're not producing enough serotonin, now you're not sleeping as well. Okay, so B12 has a direct impact on sleep. Okay, so again, it is that secondary link to mood, but also to that fatigue issue that so many people say, B12 has helped my energy level, etc. Okay, so it's not just those mood issues also, but B12 deficiency has been linked to depression, okay? And it's been linked to a whole myriad of psychiatric conditions, all right? This really has to do with its link to methylation. It's linked to detoxification as well. It's maybe not a black or white answer, but when you're helping to methylate and you're helping to detox and you're helping to produce neurotransmitters, you're lowering your risk to have psychiatric conditions that are all caused by imbalances in those things. In methylation, you're not clearing metals and toxins properly, and you're not producing neurotransmitters. That's where these psychiatric conditions come from. Some imbalance or deficiency in those. Depression, bipolar, OCD, anxiety, irritability, aggressive behavior in kids and adults, again in the elderly, among other conditions, all show that link, okay? So another critical role of B12, a little more on the alternative side, it's also links to methylation, but it is lowering homocysteine, okay, which is great for your heart, helps to prevent heart disease, all right? Homocysteine is technically an amino acid found mostly in meat intake, And obviously you don't want to have, this incredibly high meat intake, but the real issue is you're not clearing the homocysteine, okay? If your B12 level is low, or if your B vitamin status is low. So you could eat, a nice, well-balanced diet, maybe not excessive in meat. There's nothing wrong with that. That's not going to directly, increase your homocysteine. I don't mean to infer that, but if you're not clearing it, that's where the real issue comes in, okay? So the critical elements of heart disease include clotting, damage to the lining of the arteries. Those are all exacerbated by elevated homocysteine, which can come from having decreased B12 status because you're not able to clear it, okay? So also something new that's recently come out is that homocysteine levels are associated with fatigue directly. Okay, they've actually done a study recently that studied, particularly it was women with chronic fatigue syndrome and fibromyalgia, and they directly linked their homocysteine levels, found that they all had elevated levels compared to the general population. So why exactly is it causing that? We're not sure. It's probably some link of all the things we've mentioned, but they've clearly seen that link in chronic fatigue and fibromyalgia. All right. Also, with homocysteine, I found very interesting in a study was that there's a link to premature cardiovascular disease and MIs. So they found that people who have had MIs at a young age are more likely to have very elevated homocysteine levels. So what causes a B12 deficiency? It's not just about who doesn't supplement, okay? Number one, it's a lack of intrinsic factor, okay? That's, again, the protein needed to absorb B12, all right? It's also can be caused by medications that you take. Again, it's going back to, huge link with elderly people, that vicious cycle. You need the meds because you're elderly, and now you're lowering your B12, so now you're increasing your risk for dementia. So in particular, those medications are PPIs, proton pump inhibitors. That's your Prilosec, Protonix, etc., Nexium, but also H2 blockers as well, like Zantac and Pepcid. So basically any of those types of antacids, not like your Tums, but the pill antacids, particularly the PPIs. Also metformin, okay? Metformin is a pretty good drug, but it can lower your B12. So that's something you could easily remedy by getting your level checked and, if needed, taking B12. Also, as we age, there's lower stomach acid, and acidity is needed to absorb B12. Alcohol consumption also lowers your B12 levels. Also, a myriad of stomach conditions, really inflammatory stomach conditions, chronic gastritis, inflammatory bowel disease, irritable bowel, celiac, Crohn's, kind of that whole family of GI inflammation can all decrease your B12 level. Also, any bacterial overgrowth, H. pylori, SIBO. Again, it's a vicious cycle. B12 deficiency is a symptom of these conditions, but when you have a low B12, you're making them worse. It's another one of those vicious cycles, cause and effects, okay? Studies have shown that B12 does help to prevent dysbiosis. Dysbiosis is basically just an imbalance to the bad of bacteria. So there's more bad bacteria in the gut than good. So B12 can help to prevent that. So another link is with vegetarians and vegans because of the high B12 levels in meat, particularly with vegans, because B12 is found in dairy and eggs, and vegans don't eat meat. You want to be a little more careful if you are a vegetarian, or in particular a vegan. So kind of to wrap up here, about our B12 supplement, B12 Essentials. Ours is hydroxycobalamin. Traditional medicine, you're going to get cyanocobalamin. Kind of what's been all the rage is methylcobalamin. We do carry methylcobalamin as well, just because we certainly fine with it and we get a lot of requests for it. But our B12 Essentials in our Essentials line, the one that we recommend and have for years, is hydroxycobalamin. So we'll get to why here. The B12 is actually the cobalamin part of that. Okay, but to be absorbed by the body, you've got to be bound to something. So again, traditional medicine, cyanocobalamin, it is synthetically made, okay? It does contain cyanide. That cyanocobalamin is what it sounds like. Now, it is such a low amount, it's not going to harm you. But, people with severe kidney issues who can't process it, it's not real good. So, you've got all that going on, but we typically do not recommend, certainly, cyanocobalamin. That's what you're going to get in, traditional medicine. That's what the shots are, all right? So, like I mentioned, kind of all the rages is methylcobalamin. It is an excellent form, okay, especially if you're using it maybe for mood issues where methylation is key, or detoxification issues where it's key. There's nothing wrong with doing that. But overall, hydroxycobalamin is the best form, okay? Number one, the product itself is sublingual, so you're bypassing the gut, all right? Because if you have low intrinsic factor, if you're taking a med that blocks absorption, if you don't have very good stomach acidity, you're not going to absorb it well, okay? So hydroxycobalamin does not need intrinsic factor to be absorbed, and you're doing it sublingually, so you're maximizing absorption that way, okay? You're taking it directly in sublingually via the mucous membranes, okay? Hydroxycobalamin also versus cyano has a 6-day half-life, lasts in your body much longer. Cyanocobalamin is 20 to 50 minutes, that's all right? But kind of to the nitty gritty here, why hydroxy versus methyl, okay? It's because your body converts hydroxy on demand when needed at the biological level to methylcobalamin. Again, when and where your body needs it. Certain areas of the body are going to need it at certain times, and hydroxy directly and immediately converts. And also, to what's not supplemented, what's not talked about much, is adenosine. Okay, so when you take methyl, it does not convert to anything. Okay, you're gonna take methyl, you're gonna get methyl. Nothing wrong with that, but it's not ideal. When you take hydroxy, you're getting methyl because it's directly converting, and you're getting adenosine. Okay, so why adenosine? Adenosine is the preferred over hydroxy, over cyano, over methyl. It's the preferred form by the mitochondria. The mitochondria is where essentially your body makes cellular energy. That's the energy production part of the cell. Every single cell has one, okay? So your body, the mitochondria wants that adenosine, and when you're supplementing with hydroxycobalamin, your body can use that and call that on demand. If you're taking methyl, it cannot do that. You're at the whim of what your dietary intake can be, okay? So that really is the critical component here, and why we continue after all the years to recommend hydroxy. It is not because it's better than methyl directly, it is because your body will get methyl whenever it needs, but it also will get that adenosine that the mitochondria craves. Thank you for listening. If you like what you heard here today and want to hear more of what we have to offer, make sure you subscribe to our YouTube channel and click the bell to make sure you get the latest notifications.